Hello, everyone. My name is Dr. Dwight Dunnigan, COO of Epinol Incorporated. I want to talk about a subject today that is probably not the easiest for everybody. Let's talk about drug addiction and recovery. If you don't know me and you haven't seen some of our other content, I'm a clinical psychologist by trade. I've been very fortunate to have worked at substance abuse centers, mental health centers, started some of them from the ground up and grew them. Also worked at the hospital settings for both brain injury and substance abuse, okay? Along the way, I've worked with probably now over thousands of patients and clients. Let me offer a unique perspective. I can't tell you the exact number of patients, but it's definitely over several hundred. I would sit with folks in a one-on-one setting or occasionally a group setting, and I would hear them say something like, I don't think I can be here anymore. Now, this is usually somebody in detox or maybe the residential level of care, the next level of care after detox. They'd say things like, I don't think I can be here anymore. I just need to go out. I need to party one more time, get this out of my system. And this conversation amongst late 20s to young 40s, that age range of people, always use this term, I just need to go party, or I want to go party. After a few years of my career, I continuously asked questions. And I had one gentleman in particular just say it probably the best. I asked him very simply, who are you going to party with? And he said, nobody. He's not the only one, guys. This was the answer of hundreds of people in active addiction. When I got to the crux of who they're partying with, at this point in their life, it is them calling somebody to get whatever drugs they can get to go either to a hotel room or to a parent's room at a parent's house or a friend's house. And they're basically going to sit in the bathroom or sit in a hotel room and use those drugs. Now, to those of you who may watch this that are in maybe your 20s or 30s and you're thinking, hey, I'm just going to go out on the weekend and my weekend routine involves some drinking and some recreational drugs. Not all people have that same addiction, but the people that do started that same way. Teenage years, 20s, going out partying with people, using drugs for fun, and ultimately end up in their 30s and 40s sitting in a hotel room by themselves. It's an unspoken thing unless you're sitting in a recovery center. And I wanted to bring this to you on behalf of our company to say, look, we are not just bringing out a commercialized product for people to use to test at a work site or to test on traffic stops from law enforcement or to test heavy equipment operators, right? We are bringing this to home use as well. Narcolyzer is meant to go into people's homes. A spouse can test another spouse when there's a concern for their safety or a concern that they may be impaired. A parent can test somebody, a child, a teenager, a young adult. This will help with the transparency and the honesty. Narcolyzer is not a mouth swab. It is not a urine test. It is a breath test. You blow into a single-use cartridge and get rapid results. That means, coming from the lungs, whatever your body is actively metabolizing right now comes up in our system. So if somebody were to say, gosh, I did a line of cocaine last weekend and it's Thursday and it's totally out of my system. Not that we need to pick on cocaine and how long it stays in the body. That just doesn't make sense. But if that were the story and Narcolyzer was used and they came up positive for cocaine, that would mean that they would have used it within 30 minutes to a couple hours of that breath test. That means that they're impaired right now, potentially. So this device is meant to help people on their recovery journey. It's to help raise accountability within the recovery network. It's certainly going to be advantageous to all recovery centers out there. So if you have questions about this, if this is the first time you're hearing about this, if you or a loved one is struggling with active addiction and you want some more resources or knowledge, check out our website, Epinol Incorporated. It's just epinolinc.com, or go to our WeFunder page, also Epinol Inc., and you can gain more information from us. All right?